What treatments there are for a double chin is a question that a lot of people are asking about, especially on the internet. And so it's something that I wanted to address because there are really a lot of different options. Now, it really depends on what the anatomy is. When you're trying to treat a jawline or a chin, what you're trying to do is be able to understand the bony landmarks of the jaw and get a good angle to the neck instead of a lot of fullness down here or a straight line this way from this whole area being too bulky. Well, usually the problem can be addressed by just treating excess fat in this area, which is sort of covering or obscuring the whole jawline. But in other patients, there can actually be issues with these muscles or deeper fat up in there that you can't see in this diagram below these muscles, or sometimes there's just too much skin. Well, when there's fat excess, and that's the most common patient that we see, especially in a younger person who has tight enough skin that we're not worried about laxity afterwards, then probably the best treatment is liposuction. This is a tiny 2.4 millimeter cannula, a hole on one side, and through an incision under the chin here and one on each side here, we can from different angles cross and remove all the fat and define the jawline in that way. That treatment is great because if you do the liposuction, you see the fat going through the tube and it's in the canister, there's no question that it worked. The only time patients aren't good candidates for that is if the skin's too loose, because if you suck out fat or remove fat in any way, the skin's just going to get looser, right? Some patients just don't want surgery for multiple reasons. Maybe they're not a good candidate for medical reasons. And in those patients, oftentimes we'll do cool sculpting. Now, cool sculpting is a neat treatment where we use a device with an applicator in this area, gets very cold, connected there on the area of the double chin or the fat, and it sort of vacuums that area and freezes the fat, enough to kill the fat, but not enough to kill the skin. That's a neat treatment in that it's really painless, causes some numbness for a while afterwards, but it usually takes a few treatments, and that handpiece that I was showing you doesn't exactly fit everybody just right. So some patients might be better treated with Kybella. And Kybella is a treatment that it's a enzyme that we inject. It's a digestive enzyme that we all have to break down fat, except we put it in a syringe and do a little grid like that we stick on someone's neck. I guess it's backwards, it works better this way. And then we use this tiny needle, it's the same one we use for Botox, to inject along this grid, inject, inject, inject. So it is multiple injections. As soon as we put it in, within seconds, it actually dissolves the fat, and then your body, through inflammation, the immune system actually sort of eats that oil and removes it. The downside about Kybella is, well, it is 20, 30 injections, and it does burn. And then after the injection, get some pretty profound swelling, sort of like a rubbery, jiggly kind of area that looks way worse than what the patient came in with. And that lasts for a few days. And then it takes about a week to get back to normal, and then about 3 more weeks to really see the improvement. And again, that's usually 2 or 3 treatments. So the 2 or 3 treatments. So the liposuction, the cool sculpting, and the Kybella are great treatments for fat, the liposuction being the most powerful, of course. Now, some patients, like I was talking about with the anatomy, aren't great candidates for only fat removal. And the reason, again, is because they might have anatomy, not just fat, but sometimes there's not just fat under the skin, right? But fat way up there under the muscles, or salivary glands that are bulging here, or even the muscles are sort of bulging a little bit. In those patients, you need to make an incision under here and go in there and address those muscles or salivary glands or that deep fat. Sometimes we combine that with liposuction. But the most common group of patients that we see that would like to get cool sculpting or liposuction or Kybella, that can't do it, those are patients that have frankly loose skin. And if there's loose skin hanging down, maybe there is fat. And you treat the fat, you're just going to make the loose skin looser, right? And if they have, a lot hanging down and they don't like their profile view from the side, a lot of those patients, really, it's just skin. And so what those patients need is a neck lift, which is a surgical procedure, takes at least about 2.5 hours, and they're out of the social scene for about 2 weeks. So a double chin can mean different things to different people, but in general, its fat excess can be addressed like we talked about with liposuction, cool sculpting, or Kybella. Liposuction is by far the most powerful. And then if it's anything else, muscles, deep fat, skin excess, then it's a surgical procedure. So I hope that helps everyone understand what the different treatments are for a double chin.